get a warm, hearty meal to underprivileged children so they can spend the day prospering in their schoolwork.
Tonight, I wish to speak to you about the current state of the coronavirus pandemic in our country. But before doing so, I wish to express my profound appreciation to all South Africans who observed the 5 days of mourning from the 25th to the 29th of November in honor of those who have lost their lives to COVID-19 and to gender-based violence and femicide. As we remember them, let us pledge that we will do everything within our means to contain these two pandemics and continue saving lives. The global pandemic continues to cause devastation across the world, with more than 64 million infections and nearly 1.5 million confirmed deaths in a number of countries, including ours. We've seen many countries around the world experience a resurgence of the coronavirus, some with second waves even worse than their initial peak. Where South Africa once had the 5th highest number of infections in the world, we have now fallen to 14th in the world as infections in other countries, these have surged dramatically. And yet, despite the progress we've made, we've always known that a second wave of infections is possible in our own country if we do not take the necessary measures to protect ourselves and those around us. There is now clear evidence of a resurgence of infections in parts of our country, which, if not confronted decisively and directly, could lead to great suffering and death. This pandemic has already taken a heavy toll on our country. A total number of 800,872 people are confirmed to have been infected by the virus in South Africa since March. Around 92% of these people have, however, recovered, and this is good news. As of today, 21,803 people are known to have died from COVID-19 in South Africa. For nearly 100 days since the middle of August, we managed to keep the rate of new infections stable at below 2,000 new infections a day. However, that has changed in the last 3 weeks. There has been a marked rise in new infections and an increase in the number of people being admitted to our hospitals. In the first week of November, we were recording an average of 1,500 new cases a day. By the last week of November, this had almost doubled to an average of around 2,900 new cases a day. Yesterday, South Africa recorded over 4,400 new infections, the largest daily increase in infections since the middle of August. The total number of hospital admissions is now over 5,800 nationally, and it keeps on increasing. 3 weeks ago, hospital admissions were around 4,900. There are 3 areas in our country that account for most of these new infections. I alluded to some of these when I last spoke to the nation. These are Nelson Mandela Bay and the Sarah Baartman district in the Eastern Cape and the Garden Route district in the Western Cape. Hospital admissions in these districts are on the rise. In some instances, they are comparable to those during the first wave of infections. In the Eastern Cape and the Western Cape, there's been an increase in both reported COVID-19 deaths and excess deaths. This must be a concern for every one of us. There are a number of reasons for the rise in transmission. Many people are tending to travel between provinces and within each province in higher numbers, especially with the festive season now approaching. In the case of the Garden Route, this also applies to the movement of seasonal workers who work in one province and live in another province. Social, cultural, and religious gatherings are being held in large numbers. In many cases, these gatherings are often attended by many more people than what is permitted under Level 1 restrictions. What is concerning is that these are also often held in venues or places which have poor ventilation. This is particularly the case for funerals, which are often followed by large so-called after-tears parties. Several hospitals in the Nelson Mandela Bay Metro have reported a rise in alcohol-related trauma admissions. As we have said in the past, these alcohol-related trauma admissions divert our capacity that is needed to deal with COVID-related cases. But by far the greatest contributing cause of infections is that many people are not wearing masks and are not observing proper hygiene and social distancing. As I said during our last family meeting, at alert level 1, we have the measures we need to control the virus. All the tools are in place. But our main problem is that there are parts of our country where people are not complying with the current restrictions and the basic prevention measures are not being followed. The most urgent task before us now is to contain the rise in infections in the affected districts in the Eastern Cape and the Western Cape, and to ensure that a similar situation does not develop in other parts of the country. To prevent this, we're putting into motion the resurgence plan that we developed with the World Health Organization's search team. We are making more capacity available at hospitals and clinics in these areas. We are expanding public health interventions such as testing, contact tracing, isolation, and quarantine. We are also stepping up our awareness campaigns around public health regulations. Now, fellow South Africans, we must change our behavior now to prevent a resurgence of the virus and manage outbreaks wherever they occur. If we think of this pandemic like a bushfire, we need to quickly extinguish the flare-ups
Kiki's, the taste with a kick. Our revamped exclusive restaurant and takeaway now opened. Kiki's strives to serve you and your family with a wide variety of delicious meals. Enjoy our famous chicken, shish, burgers, pasta, pizza, and many more weekly in-store specials. We offer Friday buffet and Bripet with a difference. We cater for corporate functions, velimas, and events. Perja facilities provided. Our